Hi everyone. In the last video, we saw about what is pain, then the receptors of pain, how we perceiving the pain, and what is the healing mechanism of the pain. In this video, we are going to see about more about the types of nociceptors, types of pain, and move on to the next part of the pain in the physiology. In the mechanical nociceptors, we already said about it is a pressure or pinching like sensation. If you are getting mechanical load again and again in the same area, it will be perceived by a mechanical nociceptors. It reacts to the harmful interactions to the environment, or detecting a tissue injury, or anything. If you are going like in a if a bike, or if a person travels in a bike for a long period, like a delivery person, or a medical representative, something like that. If you are going in a bike for a long period, then the person may receive a pain over a low back area. Then the pain pursues to the brain, and it creates maybe it creates a little bit of a pinching like sensation in that nerve, and it may and it may travels to a sciatic pain. Then we have to reduce the mechanical load. Then the mechanical nociceptors will reduce its activity, then the pain perseverance will getting low. Next, it is a thermal nociceptors. It is for both hot and cold. If it receives an extreme temperatures, it will cause a pain. It is called as thermal nociceptors. It's like a frostbite, or if you are having any burns, it will cause a pain. It is coming under the thermal nociceptors. Then chemical nociceptors. If you are getting any tissue injuries or inflammation, that reacts with the chemical components inside the inflammation, and it will cause a pain. If you are having any inflammation over your knee, if you are having an osteoarthritis of knee, then it causes the inflammation of the joint. Then the joint reacts to the inflammatory chemical substances. Then it is because of the chemical nociceptors. The polymodal nociceptors, it's the combination of these three. What we saw in the last three, the mechanical, thermal, and chemical nociceptors. It allows the signal to diverge into these types, and it perceives the pain in these three nociceptors. The pain will be more. Then I said about the types of pain. What's been the types of pain? Is there any types in the pain? Yes, of course. There are types of pain like acute pain, chronic pain, and what we say, there's radiating pain, and there are more types of pain. There's a slow pain, fast pain. These types of pain will cause that certain duration or certain area of the pain. If you are thinking about the acute pain is nothing but if you are having any pain suddenly after the injury, or 1 week to 1 month or 2 months, it is coming under the category of acute pain. Then we go for subacute pain. Subacute pain is the duration of 2 to 6 months of the pain. Then after, beyond any pain that is perceived by the body, beyond the 6 months, it is called as chronic pain. Then next we call it as radiating pain. Radiating pain is nothing but if the pain is because of any nerves and nerve pinching sensation like cervical radiculopathy or sciatica, the pain starting area is different, but throughout the nerve course it radiates to the next part of the body. It is called as radiating pain. Then we go with the slow pain, fast pain. There are so many types of pain. Next we are going to see about the pathways of the pain. First we see that there is a reflex arc here. In this picture you will see the reflex arc. First it starts from the organ which is the starting point of the pain, and it travels through the afferent nerves through the spinal cord of the vertebra. Then it travels through the ascending tract to reach the brain. There the pain will perceived. What kind of the pain it will differentiate. Then through the descending tract, it allows the organ to perceive the pain. In the next video, we are going to see about the pathways of the pain and the what are the gate theories in the pain, we are going to treat the patient. Thank you.